welcome back to MimiSpot. I'm so excited because we're starting a whole new series on skincare. So I have a lovely guest with me today, and this is my mommy. She is a registered esthetician. She also worked for MAC. So anyway, I thought who better yet to be here to talk about skincare. So today we're starting off talking about the basics of skincare and how to recognize what type of skin you have. So let's dive right in and get started.
Thank you so much, Mimi, for inviting me on MimiSpot. I'm so excited to be here.
We're having a little girl chat.
All right, so skincare. There are basically just 4 things that you need to do to take care of your skin.
Okay.
You need to cleanse.
Okay.
You need to tone your skin.
Okay.
You need to moisturize. And you need to put an SPF in the morning.
Okay.
All right? And then an added step is to exfoliate your skin.
Okay. Cool.
All right, so cleansing your skin. You need to cleanse day and night. Use the right kind of cleanser that goes with your skin type. And we're going to talk about that in just a little bit. And I love my Clarisonic. I can't plug it in enough. I've talked about it more and more and more.
I have one. All our friends have one. It's just amazing.
Right. And it's basically, it's a cleanser, not an exfoliator. Some people think that it's very abrasive, and they now have different kinds of brushes that go with your skin type.
Okay.
So just...
so if your skin is super sensitive, you have reactive skin, which we'll get into, the Clarisonic's safe for you.
Correct. The Clarisonic just cleans your skin 6 times more than using your hands.
Wow.
So that's a big deal. It really is.
It really is.
All right. Then you need to tone your skin. And a toner is going to bring back the pH to your skin. And it also is going to pick up any dirt or makeup residue left from your cleanser that it did not pick up.
Okay. But it's not your mama's toner, right?
Right. Your mama's toner was the one that had alcohol. It used to burn your skin.
Leave it too dry.
Right. But it's not like that anymore. They have all kinds of toners out there. But I know what is your favorite toner happens to be
Pixie.
My favorite toner too.
I wonder why it's my favorite.
All right. So really, I love this toner. It has ginseng. It has aloe vera. It also has 5% glycolic.
Wow.
So it's going to exfoliate your skin. Target now carries it. I was having a hard time finding it when it first came out. And now when I see it, I just pick up 2 or 3 of them. I use it at night and I use it in the morning after I cleanse my skin.
Okay, perfect. So toner. And then what's after your toner? Moisturizer.
You moisturize your skin right after your toner. There's a moisturizer you can use if it has an SPF. Make sure that that is your day moisturizer. Okay. And not your evening moisturizer.
Okay, so how important is it to have SPF in your daily moisturizer?
Oh my gosh. The sun is, unfortunately, is the #1, breaks down your skin from your collagen and it ages you.
So it's the #1 cause of wrinkles.
Yeah.
Oh no.
So that's why it's important to use your sunscreen. And it has to be a SPF of 30 or above.
Okay, so let's say my moisturizer has 15 SPF and then my foundation has 15 SPF. That's not enough.
No. 15 and 15 does not equal 30.
No?
No.
Wow. Okay. I learned something. All right. So where can you get a moisturizer has SPF 30?
A lot of skincare lines now come with their SPF. So I use, this one is rouche-posay, and you can pick it up just at Walgreens. It's pretty pricey, but it lasts a long time, and it has an SPF of 45. Make sure that your SPF is for your skin and not your body. You don't want to smell like coconut oil.
I just thought about laying out on the beach and things like that. So no, it's completely different than the SPF you put on your body. All right.
Yeah. Neutrogena sells one. Also, a lot of your tinted moisturizers have an SPF.
Okay,
so
great.
Those would be good to think about when you go and purchase a tinted moisturizer or BB cream. Take that into consideration also.
All right, good. So SPF for during the day. So after your moisturizer, you're good to go to throw on your makeup.
Yeah.
But you should not use an SPF moisturizer at night, right?
No, absolutely not.
So you should have a different moisturizer at night, right? And what about, like for me, I have a moisturizer that is extra hydrating so that at night it can help reproduce and firm my skin. So what are some nightly moisturizers that you recommend?
There's all kinds of moisturizer depending on what you're trying to target. Like you said, I have dry skin and I have trying to target my age-defying wrinkles here. So you just kind of find a moisturizer that's best for your skin type.
Okay, great. So what about exfoliation?
Well, exfoliation, that is really important. It's an extra step that a lot of people forget, but it's really important to have an exfoliator. And depending on your skin type, again, how many times a week you should use your exfoliator. And we're not talking about the exfoliator that was being used years ago, where it was really harsh and it would tear your skin up, like the apricot. There's now advanced exfoliators that are recommended, right?
And much like softer for your skin, so it should not be very abrasive.
Yeah, if you use an exfoliator and you're red and you have a rash and dry skin,
It's too harsh.
It's too harsh. It should not be like that.
Okay, great. So how often do you recommend exfoliation?
If you have dry skin, that means that your skin is
A little bit more flaky?
Yeah, more flaky, then you need to soften off that dead skin, so probably twice a week.
Okay.
And if you have oily skin, maybe just once a week.
Now, one thing that she taught me that I think is an excellent tip is if you're not using an exfoliator and you're using all these serums and spending money on skincare, it's not going to do as well of a job if you're not exfoliating, because then you're just putting all of that product on top of dead skin. So when you exfoliate your face, it's taking off all that dead skin and forcing new cells to form. So if you're not exfoliating and you're putting on all that skincare product, you're not going to get as great of results.
Right.
All right, perfect.
Good job, girl.
Girl, you taught me.
Cheers. That's right. So you need to exfoliate because, like you said, all the serums are just sitting on top and they're not absorbing. So it's really important to exfoliate your skin.
All right, perfect. Now let's get into recognizing what type of skin you have. What are some tips that you can tell the audience here how they can figure out what type of skin they have?
All right, good question. So you really need to go to your local esthetician to find out what kind of skin you have. But I'll go ahead and give you some little tips that you can use at home to figure out basically
just kind of get you started.
Right. So go ahead and cleanse your face,
Okay.
and then you're going to pat it dry with a towel and let it sit for just a little bit, and then you're going to use a blotting tissue. And let me go ahead and put down my wine so I can demonstrate a little bit here. So you're going to let your face dry for a little bit, and you're going to blot different areas of your skin. Okay. So blot your cheek, and it comes out dry. If you blot your T-zone along with it, and it's still dry, doesn't stick, then you have dry skin.
Okay.
Also, I come out of the shower. I have dry skin.
All right.
And I know when I wash my face, I come out of the shower, I need to run to my moisturizer. I just feel like it's like
what does mean?
Just like
tight? Like if your skin feels tight. Okay.
Everybody knows what is.
Okay. Moving on. So now you figure out if you have oily skin.
Okay, if you have oily skin, then you blot your skin in your cheeks. It comes out translucent, and you see oil on it, and also on your T-zone, then that's a clue that you have oily skin.
All right, let's say that you blot and you don't have any oil on the tissue. It doesn't necessarily mean you have dry skin. You could have normal to combination skin, right?
Right. So we talked about dry skin. Dry skin means that you've blotted your T-zone and you blotted your cheeks, and it comes out with no oil residue. Oily skin is if you've blotted your cheeks, your T-zone, and you have oil that you've picked up, and your blotting tissue is translucent, you have oily skin. Now, combination normal skin, 75 to 80% of us have normal combination skin, and that means that you have blotted this area, which is your T-zone, all right, and that's where your sebaceous glands are.
Okay.
And
your sebaceous glands create the oil.
Right.
Okay.
And then you blot your T-zone, and it comes back
a little oily.
That's but then
okay.
your cheeks are dry.
Mm-hmm.
Then you have normal combination skin.
Okay, cool.
And then there's one more type.
What's that?
That is sensitive reactive skin.
Okay.
Sensitive reactive skin, you'll recognize it. Most of you know who you are. The ones that are allergic to everything. You're allergic to the sun, you're allergic to SPF, any kind of skincare products. You're having a reaction to those products.
Okay, so you put something on your face and then it comes back red, or you have a rash or irritated, then you have a reactive skin type.
Correct. And different things determine your skin type. For example, your genes, what you eat, your medications that you take, your hormones that basically is a big determining factor. And your skin type changes within months also. Sometimes within a couple of months, you can change from having dry skin to normal to oily skin.
So you're saying like the different types of seasons, because I know during the winter my skin is just screaming for moisture, and then in the summertime I don't need as much moisturizer. I don't need such a heavy moisturizer, right?
Right.
Okay, perfect. So that was the basics of skincare and figuring out what type of skin you have. I know I have a question, and a couple girls had some questions as well that I'm going to try to have her answer. So what about...
Did you prep me on these?
No. Okay, so my question is getting a facial. So is it worth the money, and how often should you do it?
Okay, so getting a facial really determines on what type of skin you have and what kind of results you want.
Okay, perfect. Right?
Right. So if you have a target or you have a problem area that you want to focus on, then you go to your esthetician and she's going to focus and give you your specific products for that area. If you have acne, she's going to focus on acne. If you have aging skin, or if you have pigmentation, then she's going to focus on pigmentation. Yes, you're going to use your skincare, which is really important because you can't go to your esthetician once a month, once every 6 months, and then, you know,
expect her to perform miracles.
Right.
So what you're saying is every day and every night you brush your teeth, and every 6 months you go to get a deep cleaning, kind of like washing and taking care of your skin. You do it day and night, and then going to an esthetician every couple of months to get a deep cleaning so she can focus on target specifically what you need for your skin type.
Correct.
Next question is how to treat dark spots.
All right. Dark spots are caused from, unfortunately, the sun.
Going back to SPF, you start with SPF, you're going to get dark spots.
Right. Right. So start using your SPF now. All right. And that's not going to correct the damage that's already been done, but it's going to help future sunspots.
Okay.
Okay.
So let's say you already have dark spots. How do you treat them?
You are going to ask your esthetician what to use. There are skin brightenings. Vitamin C is a skin brightener. Retin A is also going to get rid of sunspots and your fine lines and wrinkles. Hydroquinone is another product. It's a lightening cream.
Okay. Another question is about, I put on my foundation and you can still see my lines and wrinkles. How do I get rid of that?
All right. Use a primer. That's the number one quick fix that you can do. There's all kinds of things that you can do that are going to take a little bit more time, like using, exfoliator, a retin A, getting chemical peels and so forth. But right before your foundation, you can put on a primer.
And so what a primer is going to do is going to smooth out the surface, and then you put your foundation on over it, and then your foundation lasts longer, and B, is going to try and hide, imperfections and lines and wrinkles. So number one question that I have is how to reduce the appearance of pores. How do we do that?
Well, your pores are your sebaceous glands. So make sure you just keep them clean. All right, just use your cleanser. And imagine if you have a pore, all right, and it's filled with bacteria and it's filled with dirt and your makeup, then your pores are going to look larger.
Right.
But if you go in there and you cleanse your face and you wash your face really well and you use your toner, then it's going to minimize and reduce your pore.
All right, perfect. And then what about, so again, after you're done with your cleaning of your face and things like that, before you apply your foundation, like wearing a primer, and then also what I found helps, like a beauty blender, right?
Yeah, there's definitely little tricks that you can use. Like you said, like a beauty blender, go in there like a scalpel. Basically, you're just filling in the pores. It's not going to fix it, but it's going to minimize it.
Okay. All right, cool. So that's awesome. I'm so glad that we could do this together. And can you see the resemblance? Do we look alike? All right, that's it for today. And if you guys have any questions or comments, please comment down below and we can answer your questions next time. If you like what you saw, please give it a thumbs up. Subscribe to my channel for more videos. If you want to follow me, you can now follow me on Twitter, Snapchat, and Instagram. Until next time, I hope you guys have an awesome week. Bye!